Bridghid McMonagle, welcome to Women's Wellness Radio.
Thank you.
Yeah, I'm excited to have you here today. We're going to be talking about some advanced solutions for skin and hair problems, and also some root cause, functional solutions for that and reasons for that. So I think this is going to be a really good detailed conversation. So before we get started, let me talk a little bit about you and your background. So you're from the Northwest, or studied in the Northwest like I did. And, practicing in Portland, Oregon, my old stomping grounds. And something I read in your bio I thought was super interesting is you did your undergrad in environmental health and spent 2 years in the Peace Corps in Thailand. You said teaching environmental medicine and writing grants. But I'm curious about the teaching environmental medicine in Thailand. What was that like? What did you do?
It was great. It was definitely, Peace Corps is kind of an emotional roller coaster of, I think as an American, not to stereotype too much, but we go over with these timelines and agendas and expectations. And then when we get into another country and another culture, those things are often much, much different. And so it was great to immerse yourself in another culture and slow things down and really change your perspective about what's important and what's not. And so they call it Thai time because things take a lot longer to get done. And then you realize it doesn't really matter probably. But so I would write grants to try to get sinks built at a school if the kids were getting really sick from food poisoning and things like that. And then trying to teach about being more environmentally friendly, things like that. It was, I think it's not really about what you accomplish in Peace Corps as much as more of the cultural exchange, because of that, several people flew to Thailand to visit me and experienced a culture they probably would have never gone to.
Mm-hmm.
And then I still have friends in Thailand that I communicate with. So that's really fun. I think it's much more a cultural exchange than anything else.
Yeah. That's super interesting. What years were you
I was there 98 to mid 2000.
Okay.
Yeah.
Well, partly I was curious. My boyfriend was in the Peace Corps. I was not officially in the Peace Corps, but I lived a year in sort of this Peace Corps life. So I was curious, since my years I was gone was about the same. Actually, I was only a year. So I think and then I started Chinese medicine school in 2000. So
And where were you?
In South America, in Guyana.
Oh, nice.
So yeah. So I was just curious what, So it sounds like you were working against communicable diseases type of thing.
Yeah, really just trying to help wherever I thought I could. Trying to, at some point I was trying to, get these cloth bags made to stop using all the plastic bags. But then you look at what our culture does with to-go containers and all of that, and you realize like you're only making
a lot of trash. Yeah.
Right. Yeah. So, I didn't want to be a hypocrite, but it was great to try to start projects and see what was finished and really just get to know local people and what their life was like was fascinating.
Yeah, I would say similar for us, they're well aware and they see it right away that you don't operate quite, you don't know the rules of the game because you're new here.
Yeah.
You definitely learn things and they learn things from you, and really cool. Yeah. So then you went back to school for naturopathic?
Yeah, then I worked in a lab for a little bit and then I went back to school, and I really didn't intend to, but I remember the homestay, you live with a homestay family the first 3 months while you're learning language. And I remember that a couple of the girls that lived there, they just wanted to be able to go to high school and not right after grade school work on the farm. And so when I came back to this country, people often said that coming back is harder than going. And that didn't make any sense to me. I thought, I know what to expect when I come home. I don't know what to expect when I go there. And it was really difficult adjusting to conversations that I wasn't really interested in anymore. And I had gone through so many experiences and I felt like here everything was the same, probably just a perception issue. And so I thought either as a woman in this country, I'll take advantage of that, or if I don't have a good perspective, I need to move out of the country. So it helped drive me to take advantage of being a female in this country and getting higher education. And so that was really a huge part of me going back to school.
Yeah, really cool. Did you have that natural medicine bent when you were an undergrad, or did that like kind of come later?
I didn't really, I grew up with, gardening and stuff like that, and some property around growing up. But it was really when I was in Peace Corps and seeing Chinese medicine being used, and just different approaches to healthcare that I thought was really fascinating. I remember being in this hill tribe, and this guy had this empty 7-Up bottle, and he was stuffing herbs in rice whiskey, and then he was shaking it up and passing it around, and it was this botanical, medicinal, horrible tasting drink. And so I just was exposed to so many different things living there that I realized there's different ways to approach health than just pharmaceuticals. So I think it was a combination of things, but a huge part of me spending time in Thailand led me down this path.
Oh, that's really cool. So now you do kind of a mix. So you're saying you do primary care, naturopathic medicine, and also this regenerative care for things like hair and skin and joints. So we're going to talk about some of your techniques. Yeah, let's dive into this topic of skin and hair, maybe from a more medical perspective. So I thought we could start kind of broad and then get really specific. So maybe just some basics for having healthy skin and hair, from the vantage point of naturopathic medicine.
Sure. So one thing I've noticed a lot is if you go to, say, a mall and some makeup counter, there's a lot of information that's really not very accurate. So I remember a woman telling me that it would be the expressions I'm making in the mirror if I'm putting on mascara or something that's causing wrinkles. And I remember thinking that 10 seconds is probably not really affecting my skin, right? My expressions of putting on mascara. And then different topical things that you could put on your face to really improve your skin. A lot of that is too late, right? So I would pay attention to things I'd hear from friends and family and out and about. And then my patients would come in and they've been to a dermatologist, and it's really rare that we talk about food and how that affects our skin. So everywhere I was looking, we were getting information that's maybe based on half-truths or not very accurate. So when we work with our patients, we're looking at, are they reacting to foods? Are they creating antibodies to different foods? We take those foods out of the diet, and often the skin clears up. Often eczema, psoriasis, things like that clear up. And it's not 100% of the problem, but it's often a big piece of the problem. So then we teach them how to reintroduce those foods and see what's causing breakouts. And so I know for myself, with gluten, it makes my face break out. And in my 40s, I was tired of having acne. And so that doesn't happen if I don't have gluten. So that was a huge piece of being able to share that with patients, to say what we eat really does matter. And there's a lot of chemicals in our food now that we didn't used to have when we were young. And then we're really working on digestive health so that we can improve digestive enzyme function and inflammation. And that changes the look of our skin too. And there's a lot of research on dairy worsening acne, worsening skin. And so we'll share research with patients and help educate them that food really does matter. So the food part is huge. The stress part is huge. Hormone balancing, acne before cycles, we can modify that. I would say, expressions during the day is also huge for wrinkles. So if you're glaring at a computer screen all day, it will affect how you look. If you don't like your partner or something and you're scowling all the time, that affects how you look. And it's probably not the 30 seconds people are putting on makeup in the morning, so it's really the lines of expression and how do we optimize those. And when we put all that together, people start to look better. And then we find when they look better, they start to want to do other things to improve their health.
That's a good point. So again, they have to see some wins and know it's helped them.
Yeah.
I was wondering if you've heard of this thing called face yoga.
So different exercises to improve wrinkles.
Yeah. Do you think that's like real?
It can help. Yeah.
I can see it because you do have all these muscles on your face, and if you sort of use some and not others, you can see the concept.
Yeah, definitely. There's a ton of muscles in the face, and so that can be helpful. And then, often we have uneven wrinkles on our face. And part of that is, we're smashing our face on a pillow often on one side every night for 8 hours at night. And so, if you can sleep like a geisha, that probably helps too, but not everybody can do that. So when we do injections, we evaluate what's uneven on the face, and it's often the way people are sleeping. Or if they're, maybe holding a phone, smashing their face. Yeah.
Yeah, I've been trying to teach myself to sleep on my back for other reasons, but now I know.
There you go.
That's a good thing. Okay, so we have food sensitivities, inflamed gut, stress, hormone imbalance, squinting, scowling. Yeah. I wondered if you could talk about maybe some more advanced specific things. These are ones that came to my mind, but you tell me what you see. I thought about thyroid, especially with like hair loss and dry skin, that kind of thing. I know you have some specialty in heavy metals, so I wondered if you see, toxicity playing in. Can you talk about any of that?
So thyroid for sure. That's the one that most people will stumble upon online, and a lot of people are convinced they have a thyroid issue, and a lot of people do. Sometimes it's just a matter of they're on one type of thyroid and we switch the manufacturer, and sometimes the hair loss stops. I've seen patients where we prescribed a thyroid, it's working really well, and they move and their pharmacy moves, and the pharmacy happened to just change to a different generic thyroid. And the patient didn't realize the pill looked a little bit different, but it's the same dose and everything. And in that month, their hair's falling out, their joints might hurt more, they might be a little bit more dizzy. And so we trace back to, you moved, you started going to a different pharmacy. And so there are several types of thyroid medication, and some people respond well to some brands and some to others. So that's a huge piece we always evaluate here. And then you asked about toxicity. So we know that there's different neuroendocrine disruptors in our environment. And so we're always looking at what those chemicals, toxins can do to our hormones, our neurotransmitters, and how do we clean that up.
Cool. Yeah. Tell me, so I know you do some IV therapy, chelation. Tell me about that.
So we'll do heavy metal testing. A lot of patients will say, I read about heavy metal testing and I want to see if I'm elevated. And I tell people, well, I don't have to test you to tell you that, because if you live, breathe, eat, drink, we definitely have elevated metals. We all have lead in our bones. We all have elevated metals. We had leaded gas till early mid 90s. So there's a lot of chemicals in the environment that we can't taste and we can't smell it. So we can't see it. So we just assume everything's fine. It's not labeled on our food that, these sausages contain lead, or this balsamic vinegar has lead. And so we're not really realizing how much we're getting exposed to. So it's kind of a fine line of not creating some kind of fear factor and making people really scared, but also empowering them to really start to shop and buy organic and GMO free and try to put their money into better quality food while we're doing testing and treating people. And we can treat in a very, variety of ways. But it's definitely a topic that's not addressed that much in medicine.
No, I'm really curious about it. I just supported that heavy metal summit that was on. I bought it, but I haven't listened yet. But I've heard some lectures on heavy metals. I've had my hair tested, so I'm learning more and more. What tests do you run? I'm curious.
We often do a baseline urine test and then a provocated urine test.
Okay.
We always want to do a baseline test just to see if someone's getting daily exposure in their home. So you might be drinking out of your favorite cup that's made in China with leaded glaze, and we need to make sure that we're not doing a provocated test chelating you for something that you're getting every day at home. So we like to compare that, and typically it's low. Typically it's fine because it's more of a chronic exposure that's getting stored in your bones and tissue that's a problem.
Okay. Is that a 24-hour urine test each time?
You can do 2 hours, you can do 6 hours, you can do 24. It just depends on what chelating agents you're using and compliance of patients. So we usually do 2 to 6 hour collections.
Okay. Yeah, I haven't done the urine test. I'm interested. I've been trying to read about which type. I read somewhat like the chronic exposure will be in your hair. And like I think you kind of said like a baseline would be an acute exposure. But yeah, the provocated makes sense to me, because if we're full of junk that is too much for us to process,
right.
it's not going to come out
Yeah.
in our urine. Okay. Yeah. Super interesting. Thanks for sharing a bit about that. So you do this testing and, protocols. Oh, I know what I wanted to ask you about. A little bit more about the chelation therapy and IV therapy. People can't picture that or don't really know what that means.
Sure. So there was the TACT trial, TACT trial, and that's probably one of the best sources for the general population to Google search and read about, which is about chelation therapy. And it was done by a cardiologist who had a grant. I listened to his radio interview, and he didn't think chelation therapy was something that was a legitimate treatment. And then he found that patients were improving with some high blood pressure and diabetes parameters. And so it finally got published in JAMA. And that's something that I can steer people towards, because there's some cardiovascular benefits to chelation therapy as well. And so, we get these numbers back and we talk about, if we bring these numbers down, what does that look like? We have one patient that had significant hair loss. He lost all the hair on his head after he had some dental work done and a flu vaccine. And we don't know what caused it or if it was either of those, but that was some of the timing. And so we've been doing chelation therapy, and his hair is significantly better. So that's been amazing.
Wow.
But we don't have a crystal ball to say, if we bring these numbers down, this is what your health is going to change. This is how your health will change. It's right. Let's get you healthier and see what happens.
So chelation is like attaching like a toxin to like a mineral, or like what is actually happening?
So chelation means claw in Latin. And so we're basically digging out metals, right? And so the chelating agents we use, it's the same kind of thing. If you went to the ER and you had acute exposure to metals, they're using the same treatments, but this is a different idea for chronic exposure. So we're injecting a substance, and it's going to bind to metals, but also to some minerals. And so the nutrients we're using have a stronger binding coefficient to certain metals than the minerals. And so it's going to pull some healthy things out as well. That's why we do some replacement minerals afterwards. But that's a way to see how much is in there. And then we keep doing that same treatment and keep bringing those metals down while we're doing some supportive care too.
Okay. And that's generally administered by an IV?
You can do oral as well. There's some other ways you can do. There's some suppositories and things, but what tends to have the best absorption and work the best tends to be IVs.
Okay. Yeah, I had a couple ozone and UV treatments at my naturopath.
Yeah.
But he actually didn't really tell me he was doing a chelator in there. Like, I don't know. It didn't come up. It's just part of his protocol. I had a pretty strong reaction both times, like bad headache, kind of that detox reaction. Yeah. And it wasn't until after the second time he's like, oh yeah, there's chelators in there. So Is that something you see much? Like, should he have been telling me to do other things with it, like during the treatment?
Well, so when you use chelating agents, you want to make sure there's no drug allergies. So a lot of them are sulfa-based. And so, you definitely PAR-Q a patient and find out if they have any allergies. This is the procedure you're recommending, if they have any questions and what the risks are with those procedures. And so that should be clearly outlined before you put a needle in someone's vein. So we definitely don't do any procedures without explaining what we're doing, and we don't put any surprises in the injectables. So.
Okay. No, I wouldn't say you were. But I guess I was asking, like, do you think getting like a headache could happen from all like the toxins coming out, or are they bound, or like what's going on that I would be reacting?
Most people do really well with chelation therapy. I would say you can get a slight headache. It doesn't necessarily signal you have a lot of stored metals or you have a little bit.
Okay.
So your reaction doesn't necessarily reflect what happens on the test result. But most people tolerate really well. Sometimes it's a dosing issue. And so you want to dose on body weight and, their detoxability and things like that. So the headache could have been from the chelating agent. It could have been from a multitude of things. It's really hard to say.
Okay. I was just
Yeah.
curious because I was like, I wonder if, because I remember when I told him, because he's another doctor, administer, all that stuff. He seemed surprised, like it wasn't common, so he was like, okay, well, I guess this is how we'd do things in the future.
Sometimes with ozone therapy and UV therapy, sometimes we can get a bit of a detox reaction. And if it happens, it tends to be the first time and tends not to be subsequent ones. So, I warn people you can get a bit of a Herx reaction or a detox reaction. And it tends to be, in general, it tends to be in some of my more chronically sick patients or maybe a little bit more frail patients, but not always. Like sometimes if someone's a heavy smoker, they might get headaches from doing these treatments. You could have a slight problem with sulfa medications too. So it could be so many different things.
Okay.
Yeah.
Well, we've mentioned the ozone a little bit. I think we dropped that name a couple times, but tell us what ozone therapy is.
Yeah. So using medical ozone is probably one of the safest, most effective things I do in my practice. I love it. I got into it. I was at a seminar learning about it, and I had a chronic foot problem, and I had my foot injected as a demonstration. And then since then, I think I did maybe 4 or 5 on myself. I would have done more, but it's hard for me to stick myself with a needle. And then I re-x-rayed my foot. So I'd had an x-ray before that seminar, and it literally looked like a rat had chewed up my first toe joint. It was horrible. And it was really, really painful. And then after a few injections, several years later, I hurt my other foot, and I thought, I want to see what happened to my other foot. And I x-rayed it, and the joint space was perfect. It was unbelievable. And so that really got my attention. I could play soccer again. I could run again without foot pain. And so that was huge for me to be able to share with patients. So, our world starts to get smaller and smaller when we have chronic pain, and ozone therapy can be amazing for improving pain. So we can use ozone as injections into joints to help regenerate joints. We can use ozone therapy systemically for improving immune system. It actually increases your number of mitochondria, so it's kind of like exercise in a bottle. We have some effects on our cytokines. We have, there's biochemistry books that are inches thick on the uses of medical ozone. Most of the research has been done in Europe, and so it's not as well known in the States, but it's probably one of the safest things you could do for your health, in my opinion. We can use it for... we can do bladder insufflations for interstitial cystitis. Mm-hmm. That is an amazing treatment. We can do various ways of applying ozone if you're younger or if your veins are really small. You can use it for sinus infections. Really, it's kind of endless what you could use ozone therapy for.
Yeah, this is definitely intriguing me. So the one I had was not an injection. It was more like gas, I think, and my blood would pass through it. Mm-hmm. So tell me, what is it like a liquid and a gas?
So most people who hear about ozone therapy, they think of pollution. That's kind of how they associate the word ozone as atmosphere pollution. And so we measure ozone in the atmosphere because it's a cheap, inexpensive thing to measure. And when it's elevated, other pollutants are elevated. And so it is a respiratory toxin. So you don't want to breathe a lot of ozone. When you have, say, an air purifier in your house and it's releasing ozone, a lot of people recognize, oh yeah, ozone helps clean up the air. So you can use it in your home to help clean up air quality. And then when we're using it medically in the body, we can do several different things. So we can take blood out, we can add ozone, so it's always a gas. And then we can mix that up and the blood becomes oxygenated. It creates something called ozonides, and then that goes back in your body. So you don't have to treat a lot of your blood. You can use ultraviolet therapy with ozone therapy. It has a very synergistic effect. And that has huge improvements on your immune system. And that was used a lot back in the 20s, 30s, and then we had antibiotics and vaccines come about, so it kind of fell out of favor.
Oh, wow. Interesting.
And now we're getting a lot of resistance, bacterial resistance. We're getting all kinds of problems. And so it's starting to be on the rise again as far as a treatment option that can be really helpful.
Okay. And then if you need it in a specific place, like a joint, you can.
Then you can inject it. Yeah.
Shoot it in.
Yeah.
Okay. And then how do you use it for the skin?
So for the skin, we can do several things. If you have, like I had a patient with a really bad acne scar on her chin. And so we just injected a little bit of gas locally 2 times and that scar went away. So you can use it for scarring. You can use it for doing some scar therapy. So if you have, let's say you've had a C-section and you have a scar that hasn't healed very well, we can do some scar therapy using ozone as part of it. And we're basically cutting the fascia away from the scar. And so sometimes scars can cause pain in distal areas. So you might have had a C-section and a year or 2 later you're having chronic shoulder pain, and people don't realize that we can do some scar therapy and relieve that shoulder pain without even touching the shoulder. So it's all about improving fascial adhesions. So that can be really helpful as well.
Cool.
Yeah.
Okay. Awesome. You can't do it as like an overall thing on your skin.
You can. So you can do low dose local injections. I find if you add PRP, it's more effective. You can inject into cellulite and you can improve the look of cellulite. You can cause some lipolysis, so breaking down some fat. So it's all, you have to do correct protocols to make it work. It can be really helpful. So one of my patients, we did some injections to tighten up her chin.
Okay.
Yeah.
Would you say it just makes cells work better? Or is it more complicated?
Yeah. So it's, we're breaking down the fibrin sheath probably for cellulite and then causing lipolysis, so breaking down fat cells. And then we're also, in simplified terms, we're oxygenating the area. So we're helping to heal scars. We're helping to lighten sun damaged areas of your skin.
Okay. That kind of helps me understand.
Yeah.
Like it's magic.
It kind of
It does a lot. It sounds like it has a lot of versatile uses. Okay. Tell us about the PRP. What does that stand for?
So the platelet-rich plasma. So we do a blood draw in the office, and we have a special centrifuge that spins down the blood in a way that preserves your platelet function. And then we add some nutrients to activate the platelets. And then we also use ozone to help activate the platelets. And then we're injecting those either in your scalp to help to regenerate hair, or we're injecting that into your face or neck for minimizing fine lines and wrinkles.
Ah, yeah, that's really cool. So it's your own platelets.
It's your own platelets. So you're not having to worry about injecting someone else's blood products. That wouldn't be safe. You're not injecting toxins into your face. And then we do something unique where we're heating the platelets and making a filler out of those platelets. And that works really well for the nasolabial folds. And so it's a really nice way to have some improvement in your face over time, where you don't, maybe the next week someone sees you and they don't say, "Oh, what did you have done?" It's more like, "Oh, you look good. What have you been doing lately?" And then over the next several months, you start to see improvements.
Okay. So how many sessions do people usually go for? Like, say they're just dealing with some wrinkles.
Yeah. So it depends on your age and the extent of damage. So, and the health of your platelets. So if you eat a high plant-based diet, you exercise, and your platelets are really healthy, they have a lot of CD34 cells, you're going to get really nice results. If you're in your early 40s and maybe your lines aren't as deep, then you might do it once a year. If you're in your 60s and your platelets aren't as healthy, you might do it once a month for 3 months and then repeat it once a year. So
it's not that often.
So we really individualize it for patients. Sometimes we'll do filler in this area the first time, and then we don't do the filler for 6 months, and we just do local injections on the face.
Okay. Interesting. So it's like a little med spa type situation, but it's different. You're not putting anything synthetic in the body in either case.
Yeah.
Right. Okay. Yeah, I think definitely a safer. I mean, are there risks? You feel like there's risks to? I've never really studied these with the Botox and all these different things.
Well, with what we do, we use a little bit of anesthesia, so there's always some risk with that, but we use local anesthesia and compounding pharmacies, so, without a bunch of preservatives. If you're doing the more common synthetic, fillers and Botox and things like that, you have to know the skill of the person providing those things. And if you go too deep or do too much, you can get permanent muscle paralysis. You can get pretty easily uneven looking facial expressions, right, if you put too much on one side. So this is a lot easier to safely get great results without having those negative side effects. The most I see here is, some women get a little bit more bruising depending on the quality of their skin. Especially the first time they do the treatment, they might get a little bit more bruising because their skin's thinner. And then as their skin's getting healthier, we notice they have less and less bruising as we go further with treatments.
So it can plump up the skin. Is it making more skin cells or making like fatter skin cells?
So it's helping to have collagen lay down in the area. So we're getting collagen production, and we're signaling stem cells to come to the area. And we treat the top of the hands as well. So in photos, you don't look a lot different. And so often women say, oh, my hands don't look so old anymore, even after one treatment, which is pretty cool.
Girl, you're selling me on this. Sounds pretty great. I'm 43, so it's not like I'm so old, but I definitely seen my skin change. I take good care of my skin. But I've been complaining I'm going through this big acne phase right now. I mean, I know my hormones are all over the place and this kind of a thing. And then I'm just wonder, if I invested in doing some things for my aging skin now, is that better than waiting till I'm, 55 or whatever?
So if you
go ahead.
Oh, yeah. So if if your wrinkles aren't as deep, you're going to get better, quicker results, and then keep them from getting as deep, right? So what I usually say is when you tackle things early, then you can do less treatments instead of waiting till there's a bigger problem.
Okay. Yeah. I'm going to put this on my shopping list. I know people don't like to talk about their look, especially when we're in natural stuff. We're like, oh, we don't want to talk about, but it does matter to us, even if you're not, what's the word, superficial or whatever, it does matter to us. We want to feel young on the inside and look young on the outside. For sure. It's nice to know there's options, because if all we had was Botox and Dove soap, that would be, but there's tons of options, even more than we talked about today. Right. So yeah, it's really cool. Okay. So you're in Portland, we mentioned, in Lake Oswego, for people who know that area. Website is lakeoswegohealth.com. We have all that linked. Is there any kind of goodies or information they can find on your website in particular?
Yeah, so we have the services offered at our clinic, and myself and Dr. Kaylee Bourgeois do the cosmetic procedures, and then we have a resident, Dr. Kenya Arnold. So we have several providers that can offer the services, and then we have an acupuncturist and a chiropractor. So a really nice, well-rounded team. And then on the website is, like I said, all the services that we do at the clinic. And it's really fun to help people kind of attain their best self.
Well, it sounds like you found a cool niche, because I know that area, we crank out naturopaths in Portland. Yeah. So it sounds like you found your thing that's a fit, which is great.
It's fun. It's really fun.
Well, Bridghid, thanks so much for coming on. It's been really interesting.
Yeah, nice to meet you, and we'll talk soon again, I'm sure.
Yeah, we'll stay in touch.
All right, take care.